Today on Discovering the Wellness Formula, we're joined with Dr. Wendy Kreider, a master certified chiropractor and passionate advocate for the body's innate ability to heal itself. Dr. Wendy's path to chiropractic care began with a deeply personal story. Struggling with chronic headaches in her mid 20s, she found lasting relief through chiropractic adjustments. This experience ignited a lifelong curiosity about natural healing, leading her to explore nutrition, wellness, and ultimately a major career change. Before becoming a doctor of chiropractic, Dr. Wendy worked as a social worker in public assistance and nursing home settings, giving her a unique lens on how pain and poor health impact quality of life. She graduated from Cleveland Chiropractic College in Los Angeles in 2004 and opened her own practice just a year later. But her journey didn't stop there. While in chiropractic school, Dr. Wendy discovered NetworkSpinal, a gentle yet transformative technique developed by Dr. Donnie Epstein. Through years of study and practice, she has reached the highest certification level in NetworkSpinal and now dedicates her work to helping others access the healing potential within their own bodies. So you first sought out chiropractic care for chronic headaches. Can you walk us through that moment and what shifted for you after just 2 weeks of treatment, Wendy?
Right. Well, I had had car accidents earlier, like 3 years earlier, and I didn't. All of a sudden, I realized I was having headaches like every day that were getting to the point where I felt like, I didn't even want to work. Like I wanted to go home and lay down every day, and realized that this was interfering with my life. And, one of my friends suggested chiropractic care, and this was after I had gone to doctors and they had diagnosed me with TMJ, temporal mandibular joint dysfunction. And at that time in the 80s, like their response was, well, you take Valium because it's a stress problem. Like you're not taking on stress very well. And so I didn't want to do that. And so I went ahead and like was asking around, and my friend said chiropractic care. And so I went to the chiropractor, and within 2 weeks of doing adjustments, he had me coming in 3 times a week. I could tell like my headaches were gone. Like I didn't feel like I needed to lie down in the middle of the afternoon. I didn't feel like I didn't have any energy anymore. And I was feeling so much better. So that was like a revolution to me, like about what chiropractic was and how it could help change things in your life.
Wow. So at this point, do you still have that diagnosis of TMSJ?
TMJ. Um, I don't
TMJ.
know because I don't seek care for that specifically because it's not an issue in my life most of the time. But I do believe my dentist said that I probably have it.
Wow. So that your doctors were probably like, "Wow, chiropractic is a treatment for TMJ."
Well, not really. The medical doctors don't really look at it that way. They were just like, oh, well, you're doing better, so that's what counts. And that was the 80s. The 80s, they were doing surgery on people's jaws who had severe TMJ. And yes, it was one of those things that they no longer do because it didn't work out so well. So at that time, I was just really grateful that I found another solution for it.
Wow, that is incredible to just be able to manage your symptoms, though, through obviously chiropractic care and different modalities. Again, super nice to meet you, Dr. Wendy. Really excited to have you. I loved hearing that you had a full career in social work before pivoting to chiropractic. What was that transition like for you personally and professionally?
Well, as I knew that, like, what I always want to do as a career is to give back and help other people. So I knew that I wanted to do something else to do that. And I'd been a social worker and public assistance and in nursing homes, and realized that there's just like only so much you can do in that capacity for people. And what I was doing was very valuable. However, there was, I felt like there was more that I could do. I wasn't satisfied always with the results of that. And so I decided, like, I had met a woman chiropractor who was doing what I thought I wanted to do with chiropractic. And she was an inspiration that I could go back to school, I could do something different. And so I started on my journey to go to chiropractic college, which, it was a stretch. I was in my late 30s at that time. So it was a stretch. I was married, to go to school, devote myself full time to a graduate doctorate program. However, like, I was able to do it because I was so inspired by, the desire to do that kind of work. And I have to say that I found my passion in life once I started doing chiropractic, and I'm really, really grateful. And so that kind of energy is what pushed me through the school and able to get to the other side, get my degree, and also start a business, because those are two very separate things.
That's really, really inspiring. I love that. I'm also this is a second career for myself as a registered dietitian. I went back to school in my late 20s, early 30s, and dove down the whole world of wellness. So I really appreciate you saying that that was also similar paths and that you had someone in your life that inspired you. And I feel very similar. So appreciate you sharing that.
Thank you.
So, what drew you to natural healing modalities like chiropractic care? I know you kind of talked already a little bit about the TMJ and the headaches that you had, but is there anything else that you would say that kind of really drew you into this other treatment modality?
Well, just the fact that, I feel like a lot of things that people suffer from, as far as pain, chronic pain, things that interfere with their energy in their life, that has to do with, that the medical doctors don't know what to do about. At this point, I feel like medical doctors often, their only answer is to prescribe something. And that's not necessarily an answer that I wanted to have. I didn't want to put, like, they had as I said, they had said Valium, like, okay, this was the 80s, they didn't have all the drugs that they have now, so that was their answer. And I knew that Valium was a highly addictive drug that altered your moods and how you were throughout your day. And I was like, no, I don't want to take that. That's not an answer to this problem for me. So then I started seeking other, ways. And once I understood chiropractic worked naturally through the body's ability to heal, I started looking into nutrition. I used to work at health food stores, cooking, vegetarianism, clean eating, just different kinds of answers to things. And so I've done all kinds of different modalities, not just chiropractic and network spinal, but also acupuncture, Reiki, different kinds of healing, nutrition, that I felt has really helped me be very healthy throughout the years.
Yeah, it sounds like something that's interesting about chiropractic is it sounds like it's like through the adjustments, there's like a reconnection of your body's natural like life force, and it almost sounds like there's like an overlap in the overall goal as what acupuncture is trying to achieve. Would you agree with that, or would you say that's like slightly different?
Well, what's different? Well, okay, I'm not an acupuncturist, so just want to clarify. I don't know exactly. I haven't had the education they've had, but what I feel is different is chiropractic. We're taught in the Western medicine, and acupunctures, of course, are taught in the Eastern medicine way of looking at the body. And what's different? What I feel the main purpose of chiropractic is to help your nervous system, which is spurs on your life force, right? It is your life force to be able to work better throughout your body and support all the functions of the body: physical, mental, emotional. And so acupuncture, I know that they have their own way of looking at it, and aligning the energy, so that is similar. And but it's I don't think it's exactly the same. And it depends on your intention. You know, is your intention to get rid of pain, or is your intention to help the body feel better, work better, and the person live better all the time?
Definitely appreciate you sharing that.
So you mentioned experiencing a transformation through network spinal. What did that transformation look like for you? And you could also speak to some of the clients you've worked with if you want.
For me, like I was in chiropractic school when I discovered network spinal. And so I had it done on me. I wasn't really a believer in it, and then I had it done on me, and I I kept taking deep breaths every time this practitioner would touch me, and I was just like, "Oh wow, like what's going on in my body that I'm responding in this way?" And so then I became passionate about learning the network spinal, and part of that is like receiving the care. So I started seeing chiropractor who does the network spinal up there in Los Angeles regularly. And one of the first things, like for me, was like I didn't really notice. You know, sometimes you don't notice things within yourself, and you have to ask your friends. So I started asking my friends. I was like, after like 3 months of care, I was like, "Do you notice anything different about me?" And what they said was, they said, "Well, all you used to talk about was, oh my God, I have this test, and oh my God, I got to study for this, and blah, 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 blah." And they say, "And you don't do that so much anymore. You're like not as worried or anxious about how it's all going to get done anymore." And so that was like a big revelation for me. I was like, oh, wow, like it's released some of my focus, and my energy isn't always on, oh my God, I can't do that. It's too much. It became more of a focus of, yeah, like I'll just get it done. So we don't have to like worry about that all the time. And so to me, like, I don't, getting through chiropractic school, I feel like it, probably helped me so much and saved me through that situation. And then just in my life, like I've gotten rid of pain that I thought was chronic. Like